So part two, um, so ulcers can happen. They can happen anywhere in your GI tract, as you probably remember from our part on ulcerative colitis and Crohn's disease. But here, it's the number one cause of upper GI bleeding. Um, and again, it's just an erosion in your gastric or duodenal mucosa. And they can get there from a number of reasons. So, two most common ways. One is a bacteria called Helicobacter pylori or H. pylori, and it's rather common. About half of adults have had this infection at some point, and it just kind of burrows underneath the lining of the mucosa of your stomach and your duodenum. Um, but only about 20% of people that actually get this infection ever really notice it, and they'll get gastritis or irritation. Um, Let me strike that. About 20% of the people that get gastritis from this will actually get the ulcer. So a lot of people will get the infection and you might feel off, but you never seek medical care from it. And then, 20% of those people will actually get the ulcer. Um, but because so many people actually get this infection, it's by far the most common cause of ulcers. It's just a numbers game more than anything else. So what do you do to get rid of the ulcer that causes this? You take antibiotics to kill the bacteria, and then to allow your stomach to heal, you take antacids. And I didn't go into a lot of details in this. It's not taking rivers of Tums or Maalox, but there are medications called proton pump inhibitors or H2 blockers. They're a special type of antihistamine that actually turn off your stomach's ability. I can't talk today. Your stomach's ability to make as much hydrochloric acid. They make your stomach a little bit less acidic, which allows the lining of your stomach to heal a little bit better. So it's not that your stomach doesn't make acid, it just doesn't make it as acidic. Your pH rises a little bit. The other thing is medications, and this is huge, especially in the Western world. So all of these medications that are going to get listed here, they decrease inflammation, and so when your stomach gets irritated, inflammation's bad because it hurts, but it's good because it draws your immune system to the area and it says, "Hey, there's damage here, repair it." And so when you take these medications, when you do get irritated, you decrease your body's own ability to respond to the infection, and as a double whammy, some of these medications are actually, they irritate your stomach on contact, and so they thin out the lining of your stomach when you take them. And so not only do they decrease your body's immune response, but they actually are a topical irritant when you take them. And so you're kind of hitting them both ways. So aspirin, ibuprofen, naproxen. So ibuprofen and naproxen are something called non-steroidal anti-inflammatory drugs, or NSAIDs. Anything that falls under that category will can irritate your stomach, and oral steroids. And the treatment is simple: stop the medication, if at all possible. There are some people, if you are, autoimmune disease, if you're a patient that has lupus or rheumatoid arthritis, sometimes this can be very hard to do. Lower GI bleeding. So this is bleeding south of where the pancreas connects into the duodenum. And the how of the bleeding is the same: is you've got something that has eroded the mucosa of the GI tract there and is now exposed that skin to bleeding. So it's not always an ulcer in this case, but something has now kind of torn the layer of the mucosa and it's just rubbing off and allowing that exposed blood supply to bleed into that tube that your GI tract is. But there are different mechanisms here, because you don't have stomach acid, you don't have vomiting, and you can't vomit past this part, but you do have a lot of stool passing through this area. And that in itself can be a little bit traumatic to your GI tract. So you should see kind of a recurrent theme come through this way too, and we will pick up there for part 3.